Redeman. I am with Nine Health Fair, and this is Kimberly Penny.
Hi.
Hi, our co-director of Health and Wellness. And today we are doing our weekly Tuesday Facebook live show, Health Happens, and it's
Testosterone Tuesday.
That's right, Testosterone Tuesday. So if you have questions, just send them to us on Facebook, and we'll answer your questions. I'll have my phone here in a second, and I'll be watching your questions as they come in, and Kimberly can answer them. And if you don't know the answer to your question and you stump us, we'll do some research and we'll get back to you with an answer. So,
Absolutely.
yes, definitely. We want to hear from you. So I want to start by reading something I found, which when I first started researching, I found it very interesting. According to a 2014 NPR report, the number of testosterone prescriptions written in the U.S. more than tripled in the past decade. But researchers suspect that much of the testosterone dispensed at clinics isn't tracked, since it's often bought with cash. This unfettered flow of testosterone, officially a controlled substance, has raised concerns among doctors who specialize in hormonal problems. And I do find that interesting, because it does seem, at least to me, that suddenly testosterone is, you're hearing about it all the time, there are these clinics popping up all over the place, and people suddenly have an interest in testosterone that I don't think maybe was there 10 years ago.
No.
Okay, yeah, so where do you think this is coming from? Why are we suddenly interested in testosterone?
I think we have an aging population, and people are their own advocates for their health these days. And when they hear something that is being advertised on the media, social media, on TV, on the radio, it sparks their interest and they want to know more about it. They are the health consumers these days. So we have more precise tests for testosterone. You can get more education for it. Be careful the sources where you get your education. Nine Health Fair wants to promote that education and give you those informed answers to make those decisions to go see your provider,
Right.
and not just go to a treatment center.
And that is why we started offering the testosterone test, to make sure people were getting quality education. So,
Absolutely.
so what are the symptoms of low testosterone?
Well, in males and females, you can have a decrease in your sex drive or your libido. You may have decreased sperm production. You will have or can have less spontaneous erections. You may have noticed that you're gaining weight, fat muscle distribution, you're losing muscle. It can also have an effect on your bone density and your bone health. For women, you can actually notice if you have testosterone, facial hair growth, that's if you have testosterone. You also may develop acne, and you may have fertility problems as well. And males can also have fertility problems with low testosterone.
And how common is it in men and women to have low testosterone? Because it doesn't, my understanding is it's not that common.
Well, no, in women, I know that it is more likely to be affected with pregnancy and with menopause where they're at, and it can cause irregular periods or absent periods. In men, usually about 1 in 4 males is what I've read, but 2 out of those 10, ages 60 and above, are experiencing that, and only 1 out of 20 men will experience the actual symptoms of it. Levels will drop by 1% after age 30, and as much as 10% every decade thereafter. Wow. It's just a part of aging.
Yeah. Yeah, is that a concern then? Like if you're older, you're an older male and you're in your 70s and 80s and your testosterone is dropping, should you be concerned, or not so much because it's normal?
It's normal, but I would definitely see your primary care or your health provider about this. You may have something else underlying that. If your testosterone came back low, it could be related to something else, heart disease, depression. It could be something going with your thyroid, with your pituitary gland. There are just so many things that can do this. And testosterone is a very powerful hormone. So before you decide to do any kind of treatment, you need those levels drawn by a healthcare professional, and you need to discuss all of your options before you do anything. Very important.
And we want to hear from you because, as we mentioned at the top of the show, there seems to be a sudden interest, and we'd love to know, what prompted you to be interested in your testosterone? I know a lot of health fair participants are getting their results back now, and many people did have their testosterone levels checked, and we'd love to know, hey, what made you want to do that, and, did you find out anything interesting? Do you have any questions about those results? And Kimberly here can certainly answer your questions, so make sure you send them in. And I'm real quick going to switch here because the questions are not coming in on my phone for some reason. So give me 1 second, because my understanding is we got some coming in. And I'm going to pull it up on the laptop here in front of me. Okay. maybe not.
And basically whatever tests, I'll just throw this in here, that you've had at the 9 Health Fair, we really want you to take those, and you are strongly encouraged to take those to your healthcare provider and get answers to what you need. And if you have any questions or need any help, you can also call the nurse line at 9 Health Fair at 303-698-4455, and we're happy to get started with you and then maybe get you on the right path and get you to be able to answer those, to ask those questions of your provider. In case you don't know or you're not feeling comfortable about that, we can help you feel more comfortable with that.
Right. So we have a question here from Carly. Oh. Is it rare for men in their early 20s to have low testosterone?
That is when they are supposed to have their highest levels of testosterone. So I'm going to err on yes.
Okay. So maybe get that checked out.
Maybe get that checked out, absolutely.
And Deborah says high testosterone in women can also be PCOS.
Yes.
What's PCOS?
Polycystic ovarian syndrome. So usually when you're in about your fertile, your 40s, you may be a little bit overweight, having trouble getting pregnant. That can be as a result of your testosterone levels.
Okay.
And it's definitely something that you should talk to your provider about.
Okay. And then Tina says, what happens to children with high levels of testosterone? How can this be treated? That's a good question, Tina.
I'm not so familiar with the pediatric stuff, but I would definitely take them to a pediatrician, which may refer them to an endocrinologist, someone to do a more intensive workup and a hormone panel. I don't know the specific symptoms, if they're having an increase in the development of pubic hair or increased size of genitals, or if they're having aggression symptoms and behavioral problems. So that's definitely something that I would call your pediatrician on.
Okay. And yeah, what happens if, going back to kind of the centers that are around here, what happens if you partake in a testosterone replacement therapy but you don't really need it? Like, can you have too much testosterone?
You can have too much testosterone, and you have to be really careful because there are lifelong adverse effects to taking something. It's a very powerful hormone, and it does, like I said, it can cause aggression, mood swings. It can be linked to heart disease. There's some controversy over that. I've read research where it doesn't really matter, but it can cause heart disease, so more to come on that. And you can also have problems if you already have an underlying cancer, like a breast cancer or a prostate cancer. So it's really something, again, you need to talk to a provider about. There are many side effects. You can have pellets injected, you can have injections, you can have gels, you can have oral tablets, and all of them have side effects. And it's a commitment, and it's monitoring, it's blood work. Let's say you're taking the pellets, those actually have to be inserted. So before you take those pellets, you would want to figure out the dose that you're on that works for you, because once those pellets are implanted, they're in for 4 to 6 months, and they gradually release a steady level of testosterone. So you really need to know how much that you need to have. Sometimes those pellets can actually come out, so it can lead to having to reimplant them, infections.
Oh.
I know, that kind of stuff. So, and the same thing with injections. You have to be trained by your physician or go into your physician's office in order to get those injections. And as we know, with injections, it can be painful, you can get rashes, you could get infections, and you really need that healthcare provider to oversee it. And then, of course, there's always the follow-up blood work. And really, you need to determine the underlying cause with your primary care provider. You do not want to just go out and buy testosterone. The FDA has not given its blessing on certain treatments of testosterone. So again, please go to your providers and avoid anything else that could come about from just taking this medication. You should always check with your provider on any medication or any herbal supplements as well.
Right. So Kim says, can you jumpstart testosterone production? Was so low, got treatment, stopped taking it because of all the hair. Will I always be low? That's a really good question.
That's a really good question. I don't know the underlying cause as to why you were low, so that is a question for your doctor. And facial hair, unfortunately, is one of the side effects for women taking testosterone. So I would see with your provider if there's an underlying cause. Have you had your thyroid checked? Other hormones, your pituitary? Is there anything else going on? I would get a full comprehensive blood panel, whatever that is your provider suggests.
Okay. And Tina asks, what are some of the telltale signs of high testosterone in women?
Telltale signs, just like we just heard, the facial hair. That's one of the big ones. Your voice could actually deepen. And it's basically anything we think of that makes someone physiologically a male. You could have increased muscle mass. But again, that facial hair can be a huge one, and the deepening of a voice.
So Heaven asks, when do little boys start increasing their testosterone levels?
I would probably say at about the time they hit puberty, because testosterone is what makes the deepening of that voice. They start to develop pubic hair, muscles.
Yeah. Okay. Yeah, and so again, these are great questions that you guys are sending in, so please continue to send in your questions and we'll answer them. So let's talk about, you've mentioned it a little bit before, but for those who are just joining us, oftentimes low testosterone is a symptom of something else. What diseases or conditions might cause your testosterone levels to drop?
Okay, diabetes is on the rise, as we all know. Actually, 86 million people have pre-diabetes, and 9 out of the 10 of them don't know it. So that's definitely something to keep your eye on and have your levels checked to see if you do have diabetes or pre-diabetes. And that's an easy test. You can have a hemoglobin A1C. Cancers can do this. Heart disease. Poor GI health, liver health, your pituitary, your thyroid, any acute illness that comes on, hormonal disorders, HIV, AIDS. There's just a bunch of different stuff that can cause your testosterone levels to drop.
So it sounds like if you have low testosterone, you might not want to just stop there. It sounds like you might want to start, do a blood chemistry screening and check out some other things.
Absolutely.
With your doctor.
Absolutely. See what your thyroid's doing. And the other thing is, we always have to go back to, are you getting enough sleep? Are you getting enough adequate nutrition? Are you exercising? Those things all help boost our moods. And it helps also with depression. I know if you don't get enough sleep, it can actually lower your levels of testosterone.
Interesting.
Yeah.
Wow.
So sleep is very important in every aspect of our health. Everything's tied together. Healthy lifestyle.
Yeah, yeah, definitely. So Allison asks, any nutritional foods to increase testosterone naturally?
There are, and I would actually have to look those up.
Okay. Well, we can look those up and
Yep.
we can get back to you. We'll
Absolutely.
probably do a blog post on this, and so that's the great thing about the Facebook Lives is usually people will continue to ask questions even after we're not live anymore. And so you can go to our website. We'll do a whole blog on the questions that people have asked and get your questions answered. Let's see. Jill says, optimizing hormones like testosterone in women can have huge benefits. Aiming for higher norms is good. Most doctors aren't educating and treating patients for longevity and optimization. Why?
That is a great question, and I think that's one that you're going to have to talk to your provider about. Testosterone can be very controversial. But if you go in there, do your research, ask the right questions, ask what you want to know, and ask them why. They're going to know better than anyone else why that they're not educating their participants, I was going to say, patients for longevity and optimization. I wish I had a better answer for that, but that's my best answer.
Okay. So let's go back to, we talked about it a little bit earlier as well, but again, for those who are just kind of joining us, and again, feel free to ask your questions. Let's talk a little bit about testosterone replacement therapy. I hear the results of its effectiveness are mixed. I read an NIH report, National Institutes of Health, and it said that it was improved bone strength and hemoglobin levels, but it may increase cardiovascular risk.
Yes, and I read last night and again today the cardiovascular risks. Research shows on one side yes, research shows on another side no, so TBD on that one. We'll have to wait for more research to come out. The one thing about increasing the red blood cells is what I learned is that can go to something called polycythemia, where you have an excess of red blood cells, and that can also cause blood clots. So there's more research to be done on that as well. But it definitely can improve bone strength for sure.
Okay. And so also going back to kind of like the replacement therapy, you mentioned a little bit about all the different ways that you can do that and how that works. But one of them, the patch or the gel, is it true that if you do a patch or a gel, you have to be careful of it rubbing off on those around you?
Very careful, and you always want to think right dose, right delivery method for each individual needs. So if a female were pregnant and she were to come up against testosterone, that can actually harm the fetus during the pregnancy. If a child gets in touch with testosterone, it can cause aggression, behavioral changes, pubic hair growth, so facial growth, facial hair growth. So it's definitely something you want to make sure they're not sleeping in the same sheets. If you're using a towel, you need to really wipe it off, or you need to have something over it so that it can't be rubbed from person to person, because it's a very, I know I've said this 10 times, it's a very powerful hormone.
Yeah. Okay. Curtis says, he asks, can long-term testosterone injections in men actually be harmful to your natural testosterone production? That's a really good question.
That's a great question. So with injections, they are a lifelong commitment. They are helpful if you have low testosterone. It does not cure the issue, so you, again, want to find out the underlying issue. But it will increase your level of testosterone. So you need to discuss this with your physician. If you have breast or prostate cancer, this is contraindicated. You need to talk about other options with your healthcare provider. They can also increase the risk of liver disease, heart disease, controversial with the heart disease again, stroke, blood clots, worsening or pre-existing prostate tumors or enlarged breasts. Your levels can start very high during those injections, and then they can drop until the next dose. So you may have that roller coaster of emotions, mood swings, activity levels, energy levels. So you have to be able to stay on track with your provider or whoever's doing these injections. And if you are doing these injections, you need to remember to follow up and get your levels checked. So I hope that answers your question somewhat, and always look for, infection at the site or anything that's going on. But it can be a lifelong thing, and
wow,
you need to talk to your doctor about that specific to what's going on with you and your health.
Mm-hmm. Okay, and Sky asks, what is the most effective way of getting incremental testosterone? I have heard of patches, injections, pellets, gels, etc.
Okay, so I don't know if you just heard about the patches and the gels. And I will talk about pellets a little bit as well. So basically it goes back to the right dose, the right delivery method for the individual needs. So this is something, again, and I'm going to keep saying it, you have to talk to your provider. Pellets are usually placed around the hip or the thigh or those areas. So pellets are put in our bodies, usually about 10 to 12 of them are implanted, and they slowly release over 3 to 6 months. They're a long-acting form of testosterone. So the drawbacks to this are you have to have them put in, and then you will need a workup. You'll need to monitor those. Sometimes you can develop an infection, or the pellets can actually pop out. If you do not research the correct dose before you have those pellets put in, again, it could send you on that roller coaster of emotions. You may be getting too much, you may be not getting enough. So that's one of the downsides of that. And you would have to have them replaced as well. And I don't know specifically when they would choose pellets over gels versus injections. It's an individual choice with your healthcare provider, because levels can really drop until your next dose, and that roller coaster of emotions it can be quite affect our daily activities.
Yes, definitely. Jen asks natural choices. So I'm guessing she wants to know, are there any natural supplements that could help boost supplement? I'm guessing, Jen, let me know if I'm wrong. But is there a natural way to boost your testosterone levels?
As with anything, there are natural ways. Again, I didn't bring a list with me. We're happy to get those and post those. But there are a lot. And so we'll do a little bit of research on that and make sure that they won't be FDA approved, but we'll look into our resources and kind of go to our trusted sources to get those for you.
Definitely. Mm-hmm. Yeah, and so anybody else, if you have questions, we'll probably be wrapping up soon, so get in your questions before we do. You know, for those who just received their 9 health fair results and that did take advantage of the testosterone testing, what is considered the normal range for testosterone?
The normal range for men is about, I've read, 280 to 1100, and then 300 to 1200. So somewhere in there. When it starts to drop down between 100 and 200, that's when you may be symptomatic and have symptoms of this. With females, women, it is about 15 to 70. On that level. And what we did is we drew the total testosterone. We didn't do the free testosterone. Most of our testosterone is bound to a protein called the sex hormone. And our testosterone is actually highest in the morning and lowest in the evening. If you've been checked for this, and if you've been having sexual issues, they would want to check a free testosterone. And they may also want to work you up if you have hyperthyroidism or certain kidney diseases.
Okay, so what exactly is free testosterone?
Free is it's not bound.
Okay.
Most of our testosterone is bound to a protein that is a sex hormone. The rest of it is just free. It's out there. So we did total testosterone. So if you have something else going on and you take your total testosterone that we drew to your provider, they probably will want to draw a free testosterone, or it's totally up to them what they want to do, a hormone panel. We just do the basic here. We want to provide the education, make sure that participants and our patients are getting what they need, the education they need at the right time for them. And we really hope that everyone takes all of their results to their healthcare provider.
Right. Yeah, so if you did take advantage of the testing and you have your results back and you have questions, definitely you can take them to your provider. You can take them to a King Soopers pharmacist and they can help you understand your results. And of course, you can call the nurses at 9 Health Fair. What's the number?
303-698-4455, and you can ask for a nurse, or you can dial 303-996-2137, and any nurse can answer your call. And if we didn't address something here today, feel free to call us, or you can email, and we will get back to you. We want to make sure we give you the accurate information. So that's why we have to go back and do a little research.
Yes, and we're more than happy to do that. And we will continue watching this post even after we're done. And so as more questions come in, we'll do research, we'll answer your questions directly, and probably write a follow-up blog too.
Okay.
All right, thank you, everyone.
Thank you.